Hey, it's Dr. Angelina with SurgiCare Arts and Ideal Body Institute. Today we're going to talk about thigh lifts again. I posted a video recently, so there was a lot of requests about thigh lifts, and as usual, not so much information about thigh lifts out there as it is on tummy tucks or breast reductions. Thigh lifts usually done, at least in my practice, for people who lost a lot of weight. We are a bariatric surgery center, so we do have a lot of patients who lose weight plus pounds. And if you were kind of bottom heavy to start with, you'll get a lot of loose skin down there, and you probably want something done for that skin. My surgery that I posted just a few days ago, that was a medial thigh lift, and that's just a straight incision, well hidden. I combined it with liposuction. I like to thin out and kind of contour the area, so when I remove the skin, it comes together very nicely and heals much better. Now, it's not the only option we have. There are also lower body lifts, lateral thigh lifts, spiral thigh lifts, Crescent thigh lifts. That's something you have to decide with your doctor because everybody is so much different. Something that works for one person will not work for another necessarily. Crescent thigh lift is when we just take a little crescent piece of skin and the upper thigh in the middle of between the legs, and that basically helps to pull up that middle thigh area up. That skin usually the thinnest, get wrinkly very quickly when you lose the weight, or if somebody had previous liposuction in the area, which I actually don't pretty much never do liposuction alone on inner thigh on anybody. It has to be combined with either vaser or body tight or both for very select few people, because I want to avoid getting that extra wrinkling. Because if we do that, then we are looking at surgical thigh lift afterwards. Crescent thigh lift is not for people with massive weight loss. It's just for people who lost some weight, maybe just skin got a little bit saggier over, with time, and so crescent lift works for them. People who had previous liposuction, who lost a lot of weight, I do like that medial approach where the incision goes just up and down the middle of the leg. It works great. We get great results with it. We can take it down below, even go below the knee and sometimes into the calf if a person lost weight, and now we have saggy skin around the calf muscles as well. Next step up, and sometimes it has to be combined. Sometimes it will be separate procedures, but we have to do inner thigh lift and then we have to do outer thigh lift. If we do outer thigh lift, there are a couple of different options. One, people will combine it with the outer or lower body lift. When we're doing a tummy tuck in the front, right, we get that incision in the front, and in the back we'll continue the same incision going up over the buttocks, but we'll lift all that skin up from the buttocks, right, to get the butt lift with it, and then we're also pulling up skin from the side of the leg, the lateral thigh, and we can pull that up as well. It has to be secured in a special way because that skin usually is very heavy, and we need to make sure that it does not separate our incision. So there's some tricks we have to do to kind of keep it in place. And then another way to do it is spiral thigh lift. Again, not for everybody, but the incision can go from kind of that line underneath the buttocks, starting from the inner buttocks area, going inside between the legs, and then coming out through the groin and going over the hip and into that buttocks area to meet in the middle, same as we do for lower body lift. So it addresses several areas at the same time. And of course, different amount of skin can be removed based on how much skin is hanging where. Different variants of the procedure. I definitely, in my practice, I do the butt lift, right? The kind of the lower body lift combined with tummy tuck, and then medial thigh lift combination is probably one of the most popular. But we do sometimes vary approaches because anatomy can be different. So if you have any questions about any of these procedures, you want to learn more, do consultation. I usually like to start consultations in telemed, much easier to evaluate you that way, save you a trip, especially now, restrictions on travel. I definitely recommend doing the telemed first. And of course, for my patients who come from out of state, that's the easiest approach. We just chit chat, you show me what you can on the camera. We try to come up with the best plan for you. And then when you're ready for surgery, some people actually will drive in or fly in for consultation prior to surgery, make that extra trip. Some people will come in a day before surgery once we already have it scheduled to finalize the plan, to do all the preoperative workup that we do to make sure we all got it right, we're on the right track, because nobody needs surprises the morning of surgery. So if you're coming from out of state, I always will see you at least a day before, if not prior, to make a final plan. So send your questions, requests, Instagram, YouTube on Ideal Body Institute, Instagram on SurgiCare Arts, and of course our email anytime, and we'll get back to you, we'll schedule you, and hopefully get you where you want to be with your skin removal.